Greetings, students. This is Weed, and we're going over some more information in Module 4. Last time, I was talking about cancer, and there were some excellent videos, hopefully, that you were able to watch to add to the information on D2L. I am a fake doctor of kinesiology, not a medical doctor, so please consult your physician if you have any questions or concerns. So today, the two topics are COVID and dementia. And we all remember the lockdowns from several years ago and how that impacted us. And we'll talk about some of the differences between COVID and other common illnesses and some historical past practices. And then we'll get to dementia and talk about that. So COVID is a communicable disease, along with the flu, tuberculosis, the common cold, etc. And so we're going to look about how the immune system works and some of the information that was given and might not have been accurate in the moment because we were looking at other factors. So some of the possible symptoms of COVID-19 are fever, fatigue, dry cough, and then there was also aches and pains, runny nose, sore throat, shortness of breath, and diarrhea. So not everyone who had the disease had all the same symptoms, ironically. And we'll see the comparison coming up here. I've had the common cold. To my knowledge, I've never had the flu, and to my knowledge, I have never had COVID-19. And you can see here are the symptoms: sore throat, runny nose, sneezing, cough. Had those. The flu, here are the symptoms. Now, I've had colds, what I would consider a cold, that had fever and or chills and muscle pain as well. But I never lost my taste or sense of smell, which I find to be an interesting side effect of COVID. So of the four components of physical literacy, which one is defined as the expectation of success times value? Is that confidence, motivation, motor competence, or the knowledge and understanding of the benefits of physical activity? The correct answer is motivation. So here's the definition again. We'll use those four terms in paragraph 3 of the essay, and you'll also see those on the final exam. So the good news is if you're physically active, whether that's exercise or just a lot of physical activity, that helps to improve your immune system, helps you to fight off illnesses and diseases and other factors, not just the chronic, such as heart disease and high blood pressure and high cholesterol, some types of cancer, but it helps to be a healthier individual, as you can see from these sources from 2021, which are relatively recent. So if you want to boost your immune system to lower your risk, again, a good defense is the best offense. Think about having a healthy diet, which we talked about earlier. We've talked about the benefits of regular physical activity and exercise. We've talked about stress. We talked about sleeping well. All of those support a healthy immune system, which helps you to be more resilient and fighting off infections and other diseases. This is a video that's on D2L that shares how the body fights off illnesses, has an immune system. Here's how viruses work. So this is interesting. This is from a medical textbook, and you can see who one of the authors are right here. Dr. Anthony Fauci. And so if you can recall back to the pandemic, there were several things that they were telling you to do to lower the risk. See if you can remember what those different items were. I'll give a second And you can also pause the video if you want to, or you can just wait another second and I will tell you those. So we were told to stop the spread, if you recall, that we were to have social distance of 6 feet. Does anyone know where that 6 feet came from? It wasn't scientific, so they weren't following the science. It was a guess. You were also told to mask. How effective were the masks, depending on what type that you wore? And then later on, they said that you should get a vaccine. Historically in medicine, here are the factors that you look at when it comes to whether or not you are at a high risk for disease or not. So look at the age. If you recall, the first round of COVID victims were mainly the elderly or other people who had comorbidities. The second round was certainly comorbidities, including type 2 diabetes and obesity. What is your immunization history? So were there any immunizations, vaccines that you had which would increase or decrease the risk of that? What are the prior illnesses that you had? So is there herd immunity? So once you come into contact with COVID, does that mean you don't get it again? Because I know several people who had it multiple times. What is your nutrition? What is your pregnancy? When they were doing the tests for the vaccines, did they do that with pregnant women? I already mentioned this, coexisting illnesses. If you're overweight, if you have type 2 diabetes, if you have respiratory issues, all of those are greater risks for death and problems from COVID. And then what's your emotional state? Are you stressed out about it, which lowers your immunity and increases the risk of infection? Here's another video about how vaccines work. Typically, in the US, how long does it take to get a vaccine to market from when its first introduction? It's usually 10 years that it has to go through the FDA and the testing and billions of dollars and looking at contraindications for pregnant women and other individuals, etc. And then it's released. How long does it take to get the COVID vaccine? Several months. So either several months is correct or 10 years is correct. Me personally, you can have a choice because you're an adult. I chose not to get the vaccine. My wife, who is an RN, she is medical. She was one of the first to have the option of getting the first vaccine, and she was one of the first that got that. And then she had some problems when they got the booster, but she never got the second or third round of that. So again, looking at the review, there's information about this. So dementia and lifestyle factors. As I mentioned before, my father died from dementia at the age of 82. So we'll look at some cognitive dysfunctions that are related to age mainly and the signs and symptoms of that. What are some lifestyle factors? And what can we do to diminish the risk to decline? So again, this is dementia and lifestyle factors, all part of SLO2. So the ages of people with Alzheimer's, as you can see, 85% of the people, 38% are 85 and older, 75 to 84 are 44%, and then only 16%, 65 to 74. Why do you think this number is higher than that number? Obviously, 85 plus, there's not as many of those as the 75 to 84-year-olds. So dementia is a loss of cognitive functioning, thinking, remembering, reasoning. It's more common in older people, and there's dementia including Alzheimer's disease, which is a specific version of that. So here are some signs and symptoms in the infographic here, and then also over here. So experiencing memory loss, poor judgment, and confusion. Everyone forgets things. Even you as young people, you will forget something and you chalk it up to not being attentive, whatever that might be, being tired, busy, etc. When you get to my age and you forget something, you start thinking, I wonder if this is early onset dementia. Difficulty speaking, understanding, expressing thoughts, or reading and writing. The actor Bruce Willis came out several years ago with expressive aphasia, where he is unable to talk and make logical sentences, which is one of the steps of dementia. My father, as he progressed, he had experienced that, and my mother-in-law experienced the same thing. Wandering and getting lost in a familiar neighborhood. My father did that. At one point, my mom went away and my dad went for a walk, and he couldn't remember how to get back home, so my mom had to call the police. I mean, it's funny, not funny. And the options are to put a tracking device on the person or to lock the doors when you leave. Trouble handling money, responsibility, paying bills, repeating questions, using unusual words to refer to everyday objects, longer times completing daily routines, uh, lots of different things that are all part of that, and then the frustration from that. So we have here an image of what Alzheimer's disease looks like as it progresses, and this is blood flow to the brain, and you can see that it changes, and that impacts that. So some progressive dementia, so you don't start out at the end, but some things that happen, you have Alzheimer's, vascular dementia, Lewy body dementia, frontotemporal dementia, mixed dementia, and some other parts of here. TBI, you'll hear about a lot of that with football players and people who have collision sports. So dementia is caused by damage to or loss of nerve cells and their connections to the brain. So things that are reversible, elevated cholesterol, that needs a blood test, deficiency of vitamin B12, check out your chronometer, thyroid problems, infections, brain tumor, medications, carbon monoxide, and diabetes. Irreversible, Parkinson's, which is misspelled there, ischemia, Alzheimer's disease, Pick's disease, Lewy body, frontotemporal degeneration, Huntington's disease, vascular diseases. So the risk factors, age is the greatest risk factor. The older you get, the more likely you have that. A family history of parents or siblings with dementia. Race is a concern. Poor heart health, again, another reason why we assess the Rockport walk test and talk about cardiorespiratory endurance. Traumatic brain injury. And look here, no behavior or lifestyle factors have risen to the level researchers being able to state this will prevent these diseases. So the more you can do to limit these things besides dying at a young age, the better it is for you. So here are some items that are encouraging but inconclusive evidence that lowers the risk. Being physically active and exercising, maintaining a healthy blood pressure, cognitive training, where you're using your brain not passively but actively. You watching a video or something like that, that is passive, where you actively do that. Healthy diet and reductions in added sugars, all are helpful. These are the standards of a physically literate individual. You will see these on the file. The references. So what can we take away from this information? Think to yourself about COVID and dementia. Are there any factors that are similar between both of them that will help to reduce the risk of COVID and dementia? I believe there are. As always, if you have any questions, please email me. Look at the student hours on D2L and or set up a WebEx. Stay strong.